Your prescription packet is not just for you to just like scribble on your answer key, okay, on your blank sheets. There's a reason why we do this. Practice or work. The research process alone, looking it up on Medscape, on Macromedics, on drugs.com, rxlist.com, that's the biggest part of the learning process. It's the biggest part. You researching on the drug is the biggest part. And I noticed some of you, it's either you copied your answers from your classmates, okay? But it'll show on the practical exam. It'll show, okay, that you didn't do the work researching. Because I'll ask you, what's the generic? How come you don't know the generic? And these are drugs that we covered, remember? I didn't go get prescriptions from different systems. I stuck with EENT. I didn't even have cancer questions, right? I stuck with EENT, which is our topic, eyes, ears, nose, and throat. Oncology, which is cancer, and E includes eyes too. An antibiotic. So I expect, because I didn't use a different prescription, I expect you that you did your work, because it will always show during participation on practical exam. So next time you get a prescription packet, make sure you're working on it. Make sure you're researching, putting in the effort to look for the brand, the generic, the class, and reading the SIG, doing the calculations as well. Okay? That's how you learn, and that's how you're not memorizing the drugs. That's how you know, like, okay, this is for this. And it's long-term. It's not just for that moment, not just for that activity, okay? You'll bring it with you till the PTCE. There was somebody who asked me, like, it's not PTCB or PTCE. Let me tell you. PTCB is the organization, Pharmacy Technician Certification Board, that administers the PTCE, Pharmacy Technician Certification Exam, okay? But many people use just for clickbait the PTCB exam, but technically it's called the Pharmacy Technician Certification Exam, okay? And patient safety is a big part of the PTCE, not just of your final exam. I don't know what happened to mine. Just your final exam, okay? So patient safety, when they redid the blueprint or the content of the PTCE, they included patient safety. That's why we added patient safety as a class and took out chemistry. But we incorporated the chemistry topics on pharmacology, which I've been discussing all the time, pharmacokinetics, pharmacodynamics, and all that basic stuff. Anyway, so patient safety helps minimize medication errors. Medication errors, what's the word? Medication errors are preventable. Let's just take this out. Medication errors are preventable. We can't fully prevent them.